I want to begin by thanking all of the incredible medical professionals, the doctors, the nurses, everybody at Walter Reed Medical Center. I think it's the finest in the world for the incredible job they've been doing. I came here, wasn't feeling so well. I feel much better now. We're working hard to get me all the way back. I have to be back because we still have to make America great again. We've done an awfully good job of that, but we still have steps to go and we have to finish that job. And I'll be back. I think I'll be back soon. And I look forward to finishing up the campaign the way it was started and the way we've been doing and the kind of numbers that we've been doing. We've been so proud of it. But this was something that happened, and it's happened to millions of people all over the world, and I'm fighting for them, not just in the U.S. I'm fighting for them all over the world. We're going to beat this coronavirus, or whatever you want to call it, and we're going to beat it soundly. So many things have happened. If you look at the therapeutics, which I'm taking right now, some of them, and others are coming out soon that are looking like, frankly, they're miracles. If you want to know the truth, they're miracles. People criticize me when I say that, but we have things happening that look like they're miracles coming down from God. So I just want to tell you that I'm starting to feel good. You don't know over the next period of a few days. I guess that's the real test. So we'll be seeing what happens over those next couple of days. I just want to be so thankful for all of the support I've seen, whether it's on television or reading about it. I most of all appreciate what's been said by the American people, by almost a bipartisan consensus of American people. It's a beautiful thing to see, and I very much appreciate it, and I won't forget it. I promise you that. I also want to thank the leaders of the world for their condolences, and they know what we're going through. They know what, as your leader, what I have to go through. But I had no choice because I just didn't want to stay in the White House. I was given that alternative. Stay in the White House, lock yourself in, don't ever leave, don't even go to the Oval Office. Just stay upstairs and enjoy it. Don't see people, don't talk to people, and just be done with it. And I can't do that. I had to be out front, and this is America. This is the United States. This is the greatest country in the world. This is the most powerful country in the world. I can't be locked up in a room upstairs and totally safe and just say, hey, whatever happens, happens. I can't do that. We have to confront problems. As a leader, you have to confront problems. There's never been a great leader that would have done that. So that's where it is. I'm doing well. I want to thank everybody. Our First Lady is doing very well. Melania asked me to say something as to the respect that she has for our country, the love that she has for our country. And we're both doing well. Melania is really handling it very nicely. As you've probably read, she's slightly younger than me, just a little tiny bit. And therefore, just we know the disease, we know the situation with age versus younger people, and Melania is handling it statistically like it's supposed to be handled, and that makes me very happy, and it makes the country very happy. But I'm also doing well, and I think we're going to have a very good result. Again, over the next few days, we're going to probably know for sure. So I just want to thank everybody out there, everybody, all over the world, specifically the United States. The outpouring of love has been incredible. I will never forget. Thank you very much.
The chair now recognizes Ms. Velasquez for 5 minutes.
Thank you, Mr. Chairman, and good morning, Dr. Azar, Mr. Secretary. So as a New Yorker and as someone who contracted COVID-19, who went through at the beginning of the crisis in New York, I will ask you if there is any value to wear masks.
Absolutely. We recommend it.
So how do you describe or assess, or what is your reaction to the fact that the first family that was sitting at the political debate, presidential debate, were not wearing masks.
So
Does that make your job more difficult?
Our recommendations are always to wash your hands, watch your distance, wear a face covering when you can't engage in social distance, and avoid settings where you can't do those three things. Now, the first family and the protective aspect around the president is a different situation than the rest of us because of the protocols around the first family.
Sir.
But our recommendations to
Reclaiming
people
my
are very
time,
clear.
reclaiming my time. It sent the wrong message to the American people that the first family, despite the fact that officials from the university went to them and asked them to follow the rules, that they were sitting there, were not wearing the mask. That's the point. So, Mr. Secretary, President Trump said at a rally to slow the testing down, please. And it is also quoted as saying that testing is overrated. Did President Trump tell you to slow the testing down?
I'm going to talk about the actions that we've done. We just this week announced $150
No, can you
million
please,
buy next
I
now
asked the question here, reclaiming my time. I'm asking you if the president tell you to slow the testing down.
I will not discuss my interactions or conversations with the president.
But it's a matter of public policy, sir.
It's a matter
It's a matter of lacking a national strategy to combat the virus.
The national strategy is available for all to see at coronavirus.gov, including the national testing strategy, including the reports that you receive here at Congress about the national testing strategy on a periodic basis.
Thank you. Rather than implement a national testing strategy, the administration has pushed down the responsibility down to the states, letting them scramble to develop out their own strategy and find their own supplies. According to a report in Vanity Fair, White House officials refused to adopt a national testing plan this spring because they believe that outbreaks were primarily in Democratic states, and it will be an effective political strategy to blame Democratic governors. And we have seen time and time again from the other side, blaming Democratic governors. Sir, can you tell me what is the situation in nursing homes in Texas and some of the other states right now?
So we've been improving in terms of deaths and infection rates in our nursing homes, and what we've done is published lists of red and yellow nursing homes that are experiencing excess cases, and we've had enhanced testing requirements that we've now imposed by force of law on nursing homes, and including with financial penalties and conditions of participation if they don't maintain control of cases and also fatalities.
So isn't it true that nearly half of all nursing home cases have occurred in states led by Republican governors?
I don't know. I don't think in terms of
Republican
Republican or Democratic governors. I think in terms of humans.
The point is that this is not a blue or red issue. This is an American issue. And so I resent when the other side come here making statements time and again about Democratic states. It's the same situation that is happening in other states. Mr. Secretary, were you involved in discussion during the spring about whether to adopt an aggressive national testing strategy or a state-led strategy?
We have an aggressive national testing strategy that also has states involved in it.
Okay. Secretary Azar, early this summer, CDC's guidance on school clearly stated that fully reopening created the highest risk. I will come back with this question on the second round. Thank you. I yield back.
I thank the gentlelady for yielding back.